Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday, and we are doing our series here on some basic entry-level core exercises, okay? All right, so now we're going to go to the side bridge. We've already done videos for the anterior core, I guess you could call it the front core, the abdominal one. We did a McGill curl-up. We will have done a bird dog, which helps get the back portion of the core, so like the lumbar multifidi if you're plural. And now we're going to do one for the side parts, internal and external obliques, okay? So we're going to start off with a modified side bridge or side plank, and then we'll, in another video, we'll do a normal or whatever, regular side bridge or side plank. Okay, modified side plank. All right, so you have to do this both sides, right? So when I'm doing whatever side is toward the mat, you're going to feel that side engaged a little more. So it's a modification because we're going to be doing it from our knees, all right? So we're in this position. Our knees are stacked, one on top of the other. We're going to do what's called an active shoulder. So see right now I'm just kind of drooping this way. We're going to engage that shoulder a bit, okay? Other hand is going to come and drape it across the front part of your other shoulder. And then what I do is I'm going to bring my hips forward, okay? So up and forward a little bit, but I go forward, just like that. There's your modified side bridge. Hold for 6 to 10 seconds, and then back down, okay? That's it. So see, I'm coming up and forward. I'm not sure if you can quite see it. If I just went up, I would still have this angle in my waist here. So I'm not just coming up, see, because I want to get flat in my back, up and forward. So I'm hinging forward, okay? And then down. So one more time, knees are stacked. The shoulder is actively engaged, so I'm not just caving in here. My other arm is draped over the front part of my shoulder. I bring my hips up and forward, so they're engaged here, and then down. One thing I didn't say in the McGill curl-up video, Stuart McGill is big on bracing. Okay, so essentially you set your abdominals before you do the motion. So think of it as if somebody's going to punch you in the stomach, and you would brace for that. Okay, so I brace, engage, and then I go up and forward. I'm holding for 6 to 10 seconds, and we're going to repeat that 10 to 15 times, and then you do the other side. Okay? Yeah. Mistakes we sometimes see with this, sometimes people are forward with it or they're backward with it, but you want to keep, if there's a rod or a line coming straight down from the ceiling, it's going through both shoulders. Okay? All right. Engage the core, knees are stacked, active shoulder, up and forward with the hips, hold 6 to 10 seconds, repeat 10 to 15 times. If you're noticing that it's bothering your shoulder, you might check at your angles. Sometimes you're too far in this way, and that cannot feel good, or sometimes vice versa, you're way out here. So check where your shoulder's located on that one, okay? All right, modified side plank. Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday. Like us on Facebook and follow us. Like our YouTube videos, ask questions, leave comments, we will get back to you. As with anything, check with your physical therapist or physician before performing any of these exercises to make sure that they are appropriate for you. Thank you.